Hello, everyone. My name is Gabe Capote, and I am the Unit Chief of the Policy Unit in the Provider Enrollment Division at the Department of Healthcare Services. I'm also joined by Katie Holtzen, Chief of the Policy and Enrollment Processing Section in PED, and Alex Hernandez, an Analyst in the Policy Unit in PED. We're also joined by Jim Elliott from the Benefits Division. Thank you for joining us at today's stakeholder hearing. We will be discussing the draft regulatory provider bulletin titled Medi-Cal Provider Enrollment Requirements and Procedures for pharmacy providers that hold a Clinical Laboratory Improvement Amendment Certificate of Waiver. The purpose of today's hearing is to provide you with an opportunity for discussion of the draft provider bulletin. For our agenda today, we will go over some reminders, then we will provide a bulletin overview and review the updated Medi-Cal requirements. Lastly, we will end with comments and questions. Before we begin, I have a few quick reminders. If you're experiencing any technical issues, please email DHCS PED stakeholder at dhcs.ca.gov for assistance. Please hold all comments and questions until the end of the presentation. We will have plenty of time for comments and questions at the end. Please be sure to send any questions or comments made in the chat box to everyone. We will discuss this in further detail at the end of the presentation. Only written comments received by email by 5 p.m. today will be considered prior to publication of the final bulletin. You may send your written comments to the following email address, dhcspedstakeholder@dhcs.ca.gov. When submitting your comments, please make sure you reference your name, organization, and the bulletin title. This hearing will be recorded and posted on our stakeholder hearing information webpage for future reference at a later date. We will provide a link to that webpage in the chat now. Now we will go to Alex to go over the bulletin overview and updated Medi-Cal requirements.
Thank you, Gabe, and good morning to everyone. My name is Alex Hernandez, and I'm an analyst for the policy unit in the Provider Enrollment Division. Now I will go over the bulletin overview. In accordance with Welfare and Institutions Code, Section 14043.75b, the DHCS Director is updating the requirements for pharmacy providers who apply for enrollment in the Medi-Cal program to be reimbursed for the covered services they provide to Medi-Cal members. DHCS is implementing and making specific, by means of this bulletin, W&I Code Sections 14043.15 and 14043.26, and as such have the full force and effect of law. This bulletin does not substitute for or eliminate all other Medi-Cal provider enrollment requirements set forth in the W&I Code Section 14043.26. This bulletin does not substitute for or eliminate all other Medi-Cal provider enrollment requirements set forth in W&I Code Section 14043.26. As a reminder, the draft provider bulletin was attached in the stakeholder hearing invitation email that was sent on May 23rd, 2025. It can also be found on our stakeholder hearing information webpage, which we will provide a link in the chat now. Effective August 1st, 2025, pharmacy providers that hold a valid CLIA certificate of waiver and current certificate of California Clinical Laboratory Registration may bill for CLIA waive tests provided within the pharmacist's scope of practice as defined by the California State Board of Pharmacy and authorized in Business and Professions Code Section 4052.4. Pharmacy providers must apply to enroll in the Medi-Cal program by submitting a Medi-Cal provider enrollment online application, along with all supporting documentation. Providers can access Medi-Cal provider enrollment information on the DHCS Provider Enrollment Division webpage. Now we'll go over the updated Medi-Cal requirements. Pharmacy providers who want to bill for CLIA waive tests must submit a valid CLIA certificate of waiver and a current certificate of California Clinical Laboratory Registration issued by the California Department of Public Health. The CLIA certificate of waiver and the certificate of California Clinical Laboratory Registration service address must match the service address on the new or enrolled location. Newly enrolling pharmacy applicants can submit a copy of their valid CLIA certificate of waiver and a current certificate of California clinical laboratory registration with their new enrollment application. Currently enrolled pharmacy providers can submit a supplemental application with a valid copy of their CLIA certificate of waiver and a current certificate of California clinical laboratory registration. For enrollment application information, please visit the DHCS Provide Enrollment webpage, which we will provide a link in the chat now. Now I will pass it to Katie for the comments and questions portion of this hearing.
Hi, good morning, everyone. As Gabe mentioned, my name is Katie Holtzen, and I'm the section chief for the policy and training section of the Provider Enrollment Division. Thank you for listening to our presentation about the Medi-Cal enrollments and requirements and procedures for pharmacy providers that hold a CLIA certificate of waiver. If you would like to share a comment or ask a question, you may either raise your virtual hand or type it in the chat box, as some folks have already done. Please send any comments or questions made in the chat box to everyone so everyone can see them. I'm going to go through the chat box first. I already answered a couple questions. Then I will check the virtual hand portion and answered questions verbally. Okay, so the first question I'm seeing is, will this service include the Medi-Cal MCOs or IPAs? So this is specific to providers who intend to bill Medi-Cal for CLIA waived lab services. So this wouldn't affect providers contracting with Medi-Cal MCOs or IPAs. Are there other questions to answer? And thanks for that question, Jennifer. Let me see. I'm not seeing any other questions coming up. Just so people know, there will be this is being recorded and it'll be posted on our webpage for future reference if people want to refer to this again. Okay, so Parth made the comment 99% of patients fall under MCO and eventually IPA. Yes, but this is specific to providers that are enrolling and intending to bill fee-for-service Medi-Cal. So if you are a pharmacy and you would like to enroll and bill fee-for-service Medi-Cal, this applies to you. So we have another question from Sean. Is this carved out fee-for-service similar to MTM billing? I'm not familiar with MTM billing. Can you give me that acronym, or does someone, one of my DHCS colleagues, know that acronym? MTM billing.
Did it?
Management. Deb,
Can you hear me?
Yes.
Okay. Good morning. Deborah Landreth. I am provider enrollment application processing, and my team does all the pharmacy applications. So pharmacy services are carved out. So all providers that are billing Medi-Cal for pharmacy services are enrolling in fee-for-service Medi-Cal. So this would apply to any pharmacy that is enrolling through PED. And it's not similar to MTM. MTM is a separate service that is contracted, and you have to go through a different through pharmacy benefits in order to get that MTM service. This is going to be for any pharmacy provider that is enrolled in fee-for-service Medi-Cal. They will be able to add it to their PAVE application, or they can submit a supplemental form if they're already enrolled through PAVE. Hopefully that clarifies that question. Correct, because, sorry, so you bill fee-for-service Medi-Cal, everything for pharmacy is carved out. So it all goes through fee-for-service Medi-Cal, even though all of the beneficiaries, or majority of the beneficiaries, are contracted with managed care plans. It's making it accessible to all. Just to be clear, it's making it accessible to all, not the opposite. So all pharmacies are enrolling with fee-for-service Medi-Cal. They all enroll through PAVE. and that's how they bill. And this is going to apply to all of those pharmacies that are enrolling through PAVE.
Okay, does that answer our question on carving out an MTM billing, et cetera? It sounds like it does. Okay, I think I saw a question asking how long this process takes, but I can't find that. Oh, there it is. Nope. Oh yeah, what is the time frame for processing of a new application? So we have up to 180 days to process an application once we receive it. Typically, we try to get it done before then, but the max is 180 days, and that's in statute. Let's see what else. Okay, so Sean is asking, can you clarify how the current Medi-Cal fee schedule was developed for pharmacy providers conducting CLIA waive tests and whether the rates reflect the actual operational costs and clinical time associated with these services? So in regards to billing and the fee schedule, I would refer you to the benefits division on that question. And then we also have the Medi-Cal fee and rates page, and I'll put a link in there to that. Are there any folks from benefits that would like to weigh in on that question?
Hi, this is Jim Miller for benefits. Questions about how the rates were developed, we'll have to take back and talk with the people that developed the rates.
Okay. Okay, so we will take that, we will get an answer to that question off the air for you guys and put that in the FAQ. Okay, moving through the questions. ELC Medical Arts Pharmacy is asking, we are not certified as CLIA waived yet. How long does it take to be certified as a CLIA waived pharmacy? You're going to need to reach out to CDPH and or CMS on how long that takes. That's their process, and that's not something that we are responsible for. So that I would refer you to those entities to get that question answered. I think that's all the questions that were in the chat.
Hi, Katie. There was one about Norma was asking if we're already enrolled in Medi-Cal, then can we submit a supplemental information? So that's correct. I believe the date is August 1st. After that date, you can submit a supplemental form if you're already enrolled as a pharmacy in order to add that to your enrollment.
Thank you, Deb. Okay. Oh, Jim, and then Jim added a link how to obtain a CLIA certificate. So that should help answer that question in terms of timeline. All right, are there any other questions in the chat? I'm not seeing any other ones. If any of my colleagues see any that I missed, let me know. Are there any folks raising their hands that would like to ask a question?
Hi, Katie. Yes, we have two. I'm going to go ahead and right now there's only one now. So it's Janet. So I'm going to go ahead and unmute Janet.
Okay, good morning, everyone. I'm Janet Batacom-Cherry from Health Center Partners in San Diego, our FQHC member consortia. So, of course, enrollment is different for the FQHCs, and if our pharmacists are wanting to provide these lab services, can you explain a little bit about what that would mean for them, what that would look like, or are there some kind of an exception? So some of our pharmacies it's their PPS rate, right? Pharmacies carved into their PPS, more than not, it's carved out. Pharmacy services are carved out of their PPS rate, but we do have some where it's carved in. So what would it look like for those?
So this hearing is specifically for pharmacies and pharmacy providers. So this isn't targeted or this doesn't apply to FQHCs that are providing laboratory services or pharmacy services. So I would be happy to answer that or give you more clarification off the air unless Deb wanted to hop in
I was just
now.
gonna say,
Okay.
if it's carved out, then that they're enrolled as a pharmacy, so it would be applicable. But if it's not, if the pharmacy is not carved out, then it would not be applicable. And I'm not sure if that is somehow included in the PPS rate. That's something we would have to take back and get you an answer offline.
Yeah, I would appreciate that. I mean, we do have pharmacies. We are a pharmacy provider, but for the clinics that have a pharmacy, so we fit in
Yeah.
there somewhere.
Okay, yeah, so Janet, if you could send an email, I would really appreciate it. And that email should be in the chat, but it's DHCS. Do you have that email in there
Yeah,
already?
I got it.
Okay,
I will do
perfect.
that.
If you
Thank
could send that there, we will work on getting you an answer to that question. So thank you.
Wonderful. Thanks. Thanks so much.
Of course.
We have one
fine.
more, Katie.
Yeah.
And it's from Parth. I'm sorry if I mispronounced your name. I'll be unmuting you right now.
Oh, did they go away?
Hi there.
Hi.
My name is Parth. I am a pharmacist and a pharmacy owner of Pico Care Pharmacy in Pico Rivera, California. There is a 2016 law that basically said that pharmacist providers will get reimbursed for their time for providing some services like immunization, travel health consultations, birth control. There's many other services that pharmacists can provide and get paid for them. It's called AB 1114, I believe. Under that law, we started billing DHCS for the service and the time. However, it got forwarded to to the MCOs because the patients were contracted or subcontracted out to the MCOs. So the claim went to the MCOs. MCOs said that this patient has been subcontracted to IPAs. So the claim got forwarded to the IPAs, and the IPAs said that we are not contracted with them and hence never got paid. So I would say about 95% of my claims don't get paid out under that law. I'm afraid that this will happen to repeat itself again with this service as well.
Yeah, okay. So if you would like to provide that comment in writing, we will take that into consideration when we're finalizing this draft. So if you could send your comment to pedstakeholder@dhcs.ca.gov, we would really appreciate that.
Okay, we'll do. Thank you.
Thank you. Are there any other folks that would like to ask a question verbally?
I don't see any more hands, Katie.
Okay. Okay, and I see a comment from TLC Medical Arts Pharmacy. Thank you. We will take that back into consideration with the finalization of the bulletin. Thank you. How will we hear back specifically regarding the question regarding MCO? Yeah, so we will address that in the frequently asked questions document that will be posted on the webpage for this hearing. So there should be a link in there. It's the same webpage that the hearing and the bulletin is being posted. So we will address that question in that. Of course, no problem. Are there any other questions that folks or comments that anyone would like to bring up? We really appreciate the engagement from everyone. Colleagues, are you guys seeing anything? Have I missed anything? I just want to make sure I caught everything before we adjourn. I don't see any more hands raised, no more comments. Okay. Okay. One more. Can we get the email? Can we this email address? This. So yeah, if you'd like to send your comment parts to PED stakeholder, yeah, there it is. DHCS PED stakeholder at dhcs.ca.gov. We will take your comments into consideration regarding that bill. Okay, so that wraps up the question and answer portion. We really appreciate your comments and questions. As I said, for anything that wasn't answered, we will be doing a frequently asked questions that will be posted on the webpage for this stakeholder hearing. We're going to keep the chat box up for a while so folks can copy and paste the questions and any of the links that we've provided for further resources. As a reminder, any comments or questions not shared during the hearing can be sent via email to that email on the screen. All comments, feedback, and or questions must be emailed today by 5 p.m. to that email address for consideration for the final version of the bulletin. Please make sure you reference your name, organization if you're affiliated with one, and the bulletin title in your email so we can direct it to the correct person. Thank you again for your attendance and participation. We really appreciate it. And hopefully we've gotten most of your questions answered. The hearing is now adjourned. Thank you so much.